Straight ahead on the UMC Digest, we'll talk with Dr. Luis Medina Garcia, UMC's infectious disease expert, on the COVID-19 vaccination and when it will be available for you. That's coming up right now. Thank you so much for joining us for UMC Digest. I'm Danita Cohen with UMC, and I am joined today by Dr. Luis Medina Garcia, our infectious disease expert. Thank you so much for joining us today.
Pleasure to be with you again today.
Freshly vaccinated.
That's right.
Congratulations.
Thank you so much.
Yes.
Just completed my second dose and I'm feeling great.
And you're feeling good.
Yeah.
That's wonderful. Feeling like Superman probably, right?
You know, it takes a weight off your shoulders. Rarely in medicine do you have something that's so safe and effective. 95% effectiveness is an incredible degree of protection. And so we're very happy that this could happen worldwide and that it could be made available to healthcare workers as a priority group and soon to the population at large of the United States.
So we'll talk more about the vaccine a little bit later in the show. First, though, I wanted to ask you, we're fresh off of Christmas and New Year's. We've seen that there were some mass gatherings. You've commented in the media on those mass gatherings that happened on the Las Vegas Strip. Too many people coming together. What do you expect to see as a result of what's happened over the last couple of weeks?
Unfortunately, those gatherings are ill-advised, and what pains me is that this is no longer a secret. You know, after a year of pandemic, everybody knows what the measures are, and yet our humanity still breaks through. We have such needs socially as social beings to gather and experience each other, but this is just not the time for that. And just like in other circumstances in previous holidays, a surge follows. We expect that to happen as well. We're starting to see some of it already in local hospitals, and neighboring states are having a terrible time, California specifically.
Do you think that it helps people to stay home, or does it just incite them to gather in even larger groups at home?
So that's one of the risks. It's difficult to control your behavior when you're not being observed. You know, the people that were on the Strip, I think they felt emboldened by the fact that there were so many other people out there that you can't just be singled out. But what's risky is that these small family gatherings are now becoming part of the way that this pandemic is worsening. It is worsening the spread in small, family gatherings where we let down our guard and take off our masks and spend, too much time with people outside of our household. And because of the asymptomatic transmission of this infection in many people, symptoms are just not a reliable way of gauging risk. And so those gatherings are fueling the spread of the transmission of the virus and making it very difficult for us to control it.
What are we seeing with the positivity rate right now?
So I'm not up to speed with the latest numbers from this week, but up until recently we were up in the 20% of tests. So if there's 5,000 tests done a day in Southern Nevada, maybe a little bit more, that's 1,200, 1,500 cases a day that are new.
That's 1 in every 5 people.
Right.
So if you have 5 people in your house, one of you most likely is positive.
And what's concerning is that you may not even know it. Mm-hmm. So if you don't get tested, then you just can't know. We learned that at the beginning, we had such a scarcity of tests that we had to decide to test people only if they had symptoms. And then we quickly found out that patients that did not have any symptoms could have the disease and could spread it to others. So testing really is a very helpful tool, a necessary tool to try to contain this.
Have you seen people being more compliant with wearing masks? I know last time we talked, people were really getting tired and they, weren't so compliant with masks. What are you seeing now, even anecdotally?
So I see now that people are being better about it. It certainly helps that there's a governor's directive mandating masks in our state. The enforcement of such is getting better, I think, with time. I'm not saying that people like it any more than they did before, but at least they're doing their part. So if you go out and into a business, there's signs on the door with the governor's message and the mandate for mask wearing, and people understand it. They walk up to the door without their mask, and then they pull it out of their pocket, put it on, and come in. I still see a lot of people using face shields or plastic coverings that are not masks, and those don't offer the protection that we need them to offer.
At all, right? I mean, that's just it's
Yeah,
going out the sides and out the bottom, right?
Right, and so that's what we're worried about. When you speak, you essentially spit micro droplets of saliva, and they can help with the large particles of saliva, but the small ones, they just go around that face shield and don't help much. I mean, they help some, but not enough.
Not enough. So what's mask etiquette? Do you stop somebody in the grocery store and say, hey, you're not wearing your mask right, nicely, or do you just go down the other aisle? What's your advice on that?
I think, it should be based on a sense of community, right? Just like I'm trying to protect you, it seems fitting that you would try to do the same for me out of common courtesy. Unfortunately, people can have really unpleasant reactions to being told to wear a mask. And that's, I think, in part because they may see it as an attack on their liberties. But remember that our liberties end where the liberties of others begin. So it's important to protect each other, and it is the law. So I'd say if you feel as a civilian to talk to another civilian and gently remind them that this is our duty, I think we should be able to have that conversation in public without sparking up a fight. It's just a matter of civility. And I encourage people to do it. If you feel that would create an unsafe situation for you, then don't. Just walk the other way.
With your mask on.
Yeah, but you should be able, as a business owner, to remind people that that's the mandate and that you're just trying to comply with local regulations. But it should come out of your heart, to say, look, this is something that is tried and true, that helps. Let's do everything we can to help each other.
And it's so simple.
Absolutely. And for the most part, like if you're out in public, if you're going to shopping at a place, you rarely spend more than 20 minutes at a place. So just wear it for 20 minutes, then you go out and they open or go back to your car and then you take it off.
Take it off.
You don't have to wear it at home, provided that there's no others that are outside your household.
Right.
And so it's just a small sacrifice for the greater good.
Absolutely. When we come back, we're going to talk about hospital capacity in Southern Nevada. You mentioned briefly what's happening in California. We'll talk about that and how hospitals here in Southern Nevada are doing right after the break.
During COVID-19, a lot's changed. But not the convenience of UMC Quick Care. Whatever you need us for, we're here. Now with COVID-19 safeguards. Better get better, quick.
All right, man, yeah, do it.
During COVID-19, a lot's changed. But not the convenience of UMC Quick Care. Whatever you need us for, we're here. Now with COVID-19 safeguards. Better get better, quick.
You okay, bro?
Welcome back to UMC Digest, joined today by Dr. Luis Medina Garcia, UMC's infectious disease expert. Thank you very much for being here.
You're welcome.
We've all seen in the news what's happening in California, just 4 hours away from us. Horrible things happening with the hospital capacity there and with EMS transports there. What do you make of all that?
Well, it's really an unfortunate situation because no hospital system, no health department is built for a pandemic. And the effects that are being seen now are a result of human behavior. Of course, there's an infectious disease that's causing this, but the human behavior is what we can control before vaccines are made widely available. And they're trying their best. All hospitals across the world are having a very hard time with this pandemic. But Southern California is really being crippled right now by the amount of patients that they are getting that require hospital care from COVID, by the limited amount of resources, including oxygen, which is one of the basic things that we do for COVID patients. And limits on the amount of people that can staff hospitals and nurses and physicians that take care of these patients. And those that continue to go are very tired. If you do this over and over, it takes a toll on your personal health as well. But they're bravely going out there and doing the job that they feel they need to do for society and for mankind. So luckily in Southern Nevada, we haven't reached that stage, but hospitals are at high occupancy. Crisis standards of care is something that has been mentioned out in the media, and essentially what that means is a terrible scenario where healthcare providers and hospital systems have to ration care. So normally in the US, use a triage system to help those that have the higher chance of dying first so that you can save that life. And when things get so difficult, you kind of reverse that. Triage systems were developed in war to save those that had a higher chance of living first. And so those that they thought they couldn't make it, they just, be with them for a minute and you tend to the living. So that's really the most concerning scenario, and that we wish that we never get to use those crisis standards of care, because that just means that it's so far out of control that we can't focus on saving lives of those that have little chance of recovery.
As you said, though, here in Southern Nevada, while hospitals are full, we really do a good job of working together to manage capacity. And while we are full, we have not reached what they have reached in Southern California. So
exactly.
So that's good news for Southern Nevadans.
And I think it's laudable to mention that the hospital systems have come together to develop these plans to help each other out. So internal surge capacity, staffing capacity. When one hospital can't take care of patients anymore, the others jump in to help. And we've been able to sustain our ability to take care of patients, but this relies heavily on the public's help. Help us to help you.
And we should mention too, there are different levels of care, all the way from telemedicine to our quick cares, and then to the emergency department. When should somebody use telemedicine versus quick care versus going to the ER?
Yeah, so I think those different levels of care are useful because you're able to reach patients that otherwise would be afraid to come in or don't have access to care, either because of transportation or insurance issues and such. Right now, telemedicine has the advantage of protections by the waivers that the government gave so that patients can get care. And it's an excellent way of getting good, solid advice. I always tell people there's a role for everything. And if you feel that something is really wrong with you, if you have that anguish that something's about to happen, the best thing for you to do is to show up to an emergency room or to call emergency medical services to be transported. If you have chest pain, if you can't breathe, if you pass out, if you just aren't able to communicate, if you start acting funny, that's definitely a time to go to the hospital. But if you are otherwise relatively well, I think telemedicine is an amazing opportunity for you to get good care, good solid medical advice, and gain that knowledge to know what to do should you need to go to a hospital. And especially in COVID, I think getting in contact with healthcare professionals to guide you through it is really important, because it's a very capricious disease. People can do very well and then suddenly they decompensate and require care. So you want them to know what could go wrong so that they're not hesitant about seeking medical care.
What about testing? We've talked a lot about, there's so many asymptomatic folks out there.
Right.
Who should be getting tested right now? There's still plenty of testing available here in Southern Nevada. By the way, you can go to our website at umcsn.com, both for telemedicine link and for the testing resources that are available. But when should people be tested now?
So if you have symptoms of a respiratory illness or a flu-like illness with fever, muscle aches, just not feeling well, you should definitely get a test. And it's critical because in medicine you try to figure out what symptoms the patient is having so that you can order appropriate testing. But in COVID, the symptoms are so varied that you just really can't tell on clinical grounds alone. So your doctor can have a good idea based on what you tell them, but they really can't tell. So if you have symptoms of an illness that could be, COVID-like, you definitely should get a test. If you have been exposed to a patient with known COVID, I think you should also get a test. The recommendations for quarantine have been slightly modified, and you can use a test at day 7 to shorten that to 7 to 10 days instead of 14 days. If the circumstances are right, you should definitely consult with your physician to get guidance on that. But it's important to know, right? So if you have had a contact with a known case of COVID, you should continue to take all the precautions, not just by staying home, but wearing masks inside the house, by trying to distance yourself from your family members within your household. And I think that test after exposure around day 7 adds a layer of support to stopping the isolation. And it does offer some degree of peace of mind. It's not a perfect test. No medical test is perfect. But I think it's worthwhile because it's available and because it's accessible to the population at large.
All right. When we come back, we're going to talk about that beacon of hope that came in just a few weeks ago here in Southern Nevada, the vaccine. That's right after the break.
Before the masks, before the distancing, before the world changed, UMC was ready. Our response to COVID-19 began before the crisis did, with our own team of infectious disease experts who've spent their careers planning for this moment. With a pandemic response plan, we'd practiced again and again, and by blazing new trails in large-scale testing, including every patient we admit. Always ready. UMC.
Welcome back to UMC Digest. We are here with Dr. Luis Medina Garcia, our infectious disease expert. And as we said at the top of the show, newly vaccinated. What a day that was when the vaccine came into Southern Nevada, when we all saw literally that box, right? That box coming in to start vaccinating our healthcare workers.
And it was so emotional for me because of what that represents. I mean, if you just stop for a second and think of the Herculean efforts that went into producing that vaccine across the world, is just awe-inspiring. Among the history of humankind and conflicts and fights among nations, we realized with COVID early on in the pandemic that if we didn't focus all of our scientific power into solving this one problem, it could destroy humanity as we know it. And so, for all the right reasons, everybody came together and focused on this. And, in record time, you come up with a tool to help stop or slow the progression of this disease that has killed millions of people around the world and that has upended our way of life. And I'm very careful with saying, in record time instead of rushed, because rushed gives the perception that people were careless in the development of this vaccine. And that, I think, couldn't be further away from the truth. For context, the research in developing this vaccine is based on 15 years of prior research on SARS coronavirus 1. That research actually stopped because that wasn't a problem worldwide, and the funds essentially dried up for that. But if it wasn't because of that prior research, this couldn't have been achieved. So you have a whole bunch of years of research into this, and then you get the world's best minds and brightest minds into developing this vaccine with the largest pharmaceutical companies, and some that weren't even so large, but they plugged in with the right people, with the experts in these fields, and everybody worked together to make sure that you had a good, safe product in the end. And Operation Warp Speed, I think, had a critical role in that, in removing the financial risk for companies to take this on, and to ensure that no shortcuts were taken. You just prioritize the process.
Get the paperwork through, right?
That's right.
Yeah.
And get the right people to oversee these things. You remove the financial risk, and that part of that deal was if it doesn't work, you still get paid. You're not going to lose money on research and development. And if it's not safe, we won't use it.
So there's 2 vaccines out right now, Pfizer and Moderna. They're both 2 doses.
Correct.
Taken 21 days apart, right, for Pfizer, and Moderna's a little bit different,
28
right?
days
28 days for Moderna.
For Moderna.
And the side effects, possibly a slight headache, possibly some body aches.
Yeah, a little bit of pain at the injection
Yeah,
site.
like the flu shot, right?
But it is extremely well tolerated. I was just looking at those numbers earlier today with one of my colleagues, and you have less adverse reactions to the COVID vaccine than you do to the flu vaccine. So that's encouraging. Obviously, we don't vaccinate to that scale yet, but in the amount of time we have gathering data, that's what we've observed. There have been some reports of a severe allergic reaction to these vaccines, but they have been minimal. The FDA looks very closely at these things, and they have a specific advice for physicians and people on their website, and there's very few contraindications to get this vaccine. So it's very safe. And
it is very safe. Yeah. And at UMC, and I didn't mean to interrupt you, but we vaccinated every employee who wants a vaccine,
Correct.
has had a vaccine, and then we've
Correct.
started to do firefighters and Metro.
Yes.
So we're working down the tiers. When do you think the vaccine will be available to the community at large? Because a lot of people are waiting
Yes.
for that vaccine to come their way.
So with a little bit of luck, early April, I was listening to NPR on the way to work, and Dr. Fauci was on, and they asked him precisely that question, and he thinks it could be open season by early April. So production is being ramped up by both Pfizer and Moderna. The existing vaccine supply is out there. It's been delivered to the states. I think the challenges that we're facing right now are the logistical challenges, the operational challenges of actually getting those shots into the arms. In the context of use of healthcare resources, right? So you need nurses and people to administer these vaccinations, but you also need the same nurses to take care of patients in the hospital. It's an opportunity, though, for governments and the private sector to get together and find solutions to these problems, right? So funding is an issue. The government provides a certain degree of funding, both at a national and local level, but there's opportunities for people to be, angel investors, so to speak, in the public health of their communities.
Anybody who shouldn't get the vaccine for a medical reason.
Right, so if you have had an allergic reaction to your first shot, for example, if you got the vaccine and you developed a severe allergic reaction, the recommendation from the health authorities is do not re-challenge them. Just stop. Do not use that same vaccine. It is possible for that person to get a different type of vaccine platform later on. But if you've developed a reaction to that first dose, then you should not. There's a component of these vaccines, and so if you've had a reaction to that component, then you should not get the vaccine. If you have had active COVID infection, it's not a contraindication for you to be vaccinated. What the experts are saying is you should just wait for you to complete that isolation period of 10 days, and then you can choose to be vaccinated. There's also the option for those that have recovered from COVID infection to delay vaccination for about 90 days. The reason behind that being, if you have the infection, you probably have antibodies that will protect you for at least 90 days. So reinfection in that 90-day period would be considered very rare, and it is allowed for you to just delay that vaccination until that period is ended.
What do you have to say to people who say, I don't know, Dr. Medina, I don't know if I want to get the vaccine?
I would say trust the science. This has a very personal impact on each one of us in different ways. I understand people that have not had close family members be affected. I have. And it's pretty scary because you can't predict who's going to do well and who's going to do poorly. And so if you have a chance to use science to protect yourself and the ones you love and avoid negative effects, there's just, in my mind, no justification for not doing so.
And how effective is the vaccine?
95% effective after you complete the vaccine series.
Better than any odds in Las Vegas.
That's right.
Yeah.
And it's, risk aversion is something that guides our behavior. And when you make a decision, you try to say, well, how much can I lose if I do it, and how much can I lose if I don't? Or the opposite, how much can you win if you do this? And so with COVID, it's not a binary choice. It's not just about surviving or dying from COVID. If you're lucky, you won't even know you had it. If you have a mild illness, you may completely recover and have no issues. Or you could recover quickly from the acute illness and then have inflammatory complications 6 to 8 weeks afterwards that include, sometimes severe neurologic impairment, heart failure. And these things, we don't know if they will get better, how quickly they will get better, or to what extent they will get better. So I would very much rather say, look, I'm just going to take this vaccine and not have to worry about that.
Yeah, I think I'll bet on the 95%. Yeah.
Those are pretty good odds.
Thank you so much. Your expertise and wisdom is always very helpful. So thank you so much. Before we conclude this edition of UMC Digest, we'll leave you with some of the fantastic men and women who work alongside Dr. Medina at UMC. They have worked tirelessly over the last almost year now to care for our community. Thank you for joining us for this edition of UMC Digest. We'll see you next time on Clark County Channel 4. Take care.